The data suggests that as many 1/3 of patients who've suffered stroke may suffer cognitive decline. We have not seen that in our data in some of the studies we've done, but that's widely quoted. But certainly, stroke does increase the likelihood of cognitive change among a certain number of individuals. How that exactly happens, we don't know, because the decline usually doesn't take place right after the occurrence of the stroke. It's a delayed effect. So how that is happening, is it interacting with neurodegenerative disease? Is there some kind of inflammatory response that's taking place? We really don't know the answer to that. We are looking for risk factor management post-stroke to see whether control of diabetes, hypertension, smoking, and so forth reduces the incidence of post-stroke cognitive decline, because it is a public health problem. But right now, we're still beginning to understand the mechanisms. Certainly family history, prevalence of vascular risk factors, alcohol consumption, sleep are all factors that contribute to cognitive decline. The American Heart Association published Life Essential 8, which talked about lifestyle factors and physiological factors like blood pressure and cholesterol and body mass index and so forth. So all those factors do go into whether or not there is cognitive decline. It also depends on the long-term effects of things like hypertension. Hypertension as a risk factor probably is the most prevalent and has the most profound effect of almost any of the vascular risk factors. And so trying to get people to engage in good blood pressure control is becoming a really important thing to make sure that when a stroke unfortunately does happen, it doesn't mitigate the dangers of dementia after stroke because of pre-existing neurological dysfunction.